Bismillahirrahmanirrahim. Assalamu alaikum students. Today we have discussed in class pedigree analysis. To reach a successful pedigree reading, you have to be very memorized or you have to be very clear about characteristic features of autosomal dominant, autosomal recessive and X-linked disorders, because this is the main concept which will lead you to the performance of MCQs in a specified time period. Let's discuss these disorders in a comparison manner. First of all, we have got autosomal dominant disorders. Students, in autosomal dominant disorders, only one allele is mutated. That is, mutation occur in one allele of a gene. And both males and females are affected equally. This is the main characteristic feature of autosomal dominant disorder, that both males and females are affected equally. Each child of affected parent in the next generation has 50% chance of developing the disorder. These disorders are seen in every generation. When you see a pedigree tree, if there is a skip of any generation, then this is not autosomal dominant disorder. If the disorder is seen in all the generation, then it is a clue point for analysis to be done as autosomal dominant disorder. Affected child has affected parent. This is compulsory. If the child in the generation is affected, then one of the parent must be affected. Clinical examples include Marfan syndrome, Huntington's disease, and achondroplasia. Now we compare autosomal dominant disorders with autosomal recessive disorders. In autosomal recessive disorder, the main mechanism is both the alleles are under mutation. Mutation affects both the alleles of a gene. Parents are usually carriers, and clinically they have no signs and symptoms, they are normal. I repeat, parents are usually normal apparently and they are carriers. Next is we have got males and females are affected equally. This is the main point which is common in both autosomal dominant and autosomal recessive disorders, that both males and females are affected equally. This point separates autosomal disorder from X-linked disorders. If the parents are equally affected, both males and females are equally affected, then this indicates autosomal disorder. And if only males are affected, then this indicates X-linked disorders. Then we have got horizontal pattern is seen in autosomal recessive disorder. What is horizontal pattern? That is, one generation is skipped. Siblings are affected. Increased incidence is seen in cousin marriage. Each pregnancy has 25% affected siblings, 25% normal siblings, and 50% carrier siblings. I repeat, in each pregnancy of autosomal recessive disorders, there is a chance of 25% affected siblings, 25% normal siblings, and 50% carrier siblings. These disorders are mainly seen in childhood. Examples include cystic fibrosis and sickle cell anemia. Now students, we move towards comparison of X-linked disorders. In X-linked disorders, the gene which is mutated is located on X chromosome. It is not located on autosomes, rather the affected gene is located on X chromosome. And this is the reason that males are commonly more affected in X-linked disorders. And females are usually carriers. Why this discrepancy? Because each individual harbors X chromosome from one parent and Y chromosome from the other parent. So in X-linked disorders, males are affected more because males have got XX chromosomes. Okay? Sorry, females have got XX chromosomes and males have got XY chromosome. Male child will get one X chromosome from either of the parent, from mother, and if this X chromosome contains the affected gene, the individual male will show the disorder. Whereas on the other hand, in female child harbors one X chromosome from father and one X chromosome from mother. There is a chance of masking of mutated gene on any of the X chromosome. As a result, females are very rarely affected in X-linked disorders. In X-linked disorders, we have got recessive and dominant. In X-linked recessive disorders, the affected males, they inherit genes from carrier mother. That is, if the male is affected, then at every cost, mother will be carrier. If the mother is carrier, she will produce 50% of affected sons. No female child will be affected if the mother is carrier. Only 50% chance of affected sons. But if the male is carrier, that is, if the father is carrier, then all the daughters will be affected. This is the main point which differentiates X-linked recessive disorders from other disorders, that if father is carrier, then all the daughters will be affected. So in any pedigree tree, if you find that all the daughters are affected and father is carrier, then you label is as X-linked recessive trait. Example is hemophilia A and Duchenne muscular dystrophy. Lastly, we have got X-linked dominant disorders. In X-linked dominant disorders, both males and females are affected. Students, this character resembles autosomal dominant disorder. In autosomal dominant disorders, both males and females are affected. In X-linked dominant disorders, both males and females are affected. How to differentiate? If all the daughters are affected and father is affected, then this indicates X-linked disorders. No son will be affected in X-linked dominant disorder. This point differentiate this disorders from autosomal pattern. In autosomal pattern, each child of affected parent has 50% chance. Whereas in X-linked disorders, all the daughters of the affected father will be affected. X-linked dominant disorders are commonly seen in males. So the clinical examples of X-linked dominant disorder, fragile X syndrome, and vitamin D resistant rickets. Students, I have tried my best to concise and comprehensively compare all the four varieties of disorders which will come before you in pedigree tree. And these characteristic features will help you to label the pedigree tree in minutes. And if you can analyze the pedigree tree in the light of these characteristic features, then you will very easily perform your MCQs from the genetics portion. Thank you, students. Allah Hafiz.